It's pretty tough when you have to watch your patients struggle with sleep at night. It hurts more when they have a medical condition that poses a serious threat to sleep. Dementia is one of the medical conditions that can affect one's ability to sleep. It's a general term for conditions and diseases that result in a decline in language, memory and problem-solving skills. This condition affects a person's ability to carry out everyday activities. Now, how do we get dementia patients to sleep at night? As most people may have experienced in the past, battling to sleep or not getting enough sleep can literally be a nightmare. In the case of people suffering from dementia, the inability to get enough sleep at night could be acute and also affect the quality of life they live. And it's not just them alone, even people around them get a fair share of this as they are mostly disturbed. Let's say you have someone suffering from dementia and you are looking for ways to help them get to sleep at night. First, you need to know some of the causes of sleep issues in dementia patients. Some of them include 1. Body clock. The disruption in the body's circadian rhythm will mean that the adjustment to the normal 24-hour full day is not balanced. This mix-up automatically makes it harder for most people suffering from dementia to know when it's night or day. 2. Drugs. There are drugs administered to dementia patients that cause dream disturbances and nighttime stimulation. 3. Light. When there is light in a sleeping area at night, confusion is likely to ensue on whether it is daytime or night. 4. Dreaming. Having to wake up from a dream causes confusion as it is very difficult to differentiate between reality and dream. 5. Pain. Pain in the body, especially in joints, can be a part of aging. So, it doesn't come as a surprise when older people with dementia experience nocturnal sleep disorders that make them uncomfortable. 6. Daytime nap. Napping during the day, especially when lying in bed, will lead to an inability to sleep at night. The assumption here is that they must have slept to their fill in the day and it will be totally difficult to sleep for long at night. Now, how can you help dementia patients sleep at night? 1. Check for other medical conditions. Both restless leg syndrome and sleep apnea have symptoms that will easily make a dementia patient wake in the middle of the night. To find out if your patient has sleep apnea, dedicate your time to watch and observe them when they are sleeping. It is important that you know that someone with sleep apnea pauses when they breathe and can stop breathing momentarily. This temporary stoppage of air can cause someone to wake up with force. It's a frightening experience for someone sleeping close to them as you have to wait for their breath to be restored. If your patient is diagnosed with restless leg syndrome, you will notice they twitch and move their legs uncontrollably, particularly in the evenings and at night. They also experience tingling, fizzing and burning sensations. These symptoms are relieved by stretching and rubbing legs but will certainly wake one up. 2. Get an accurate lighting. The possibility of a good night's sleep is dependent on how comfortable the bedroom is. Getting the bedroom to be comfortable is a major effort you need to take in getting your patient to sleep at night. You can use blackout curtains at night to eliminate every form of outside disturbances. Research on dementia patients has shown that light therapy reduces confusion and restlessness in people suffering from this condition. If you wish to consider this therapy, check for a violet-colored light that enhances drowsiness. You can also get a full-spectrum fluorescent light used in the first 2 hours of every day. The essence of this is to create a reality of the different lights needed for sleep time and other activities. A light therapy following a definite pattern also helps to reset the body clock. While using dim lights, you need to also consider safety. If you notice your patient makes a frequent visit to the toilet, then you will have to consider getting a kind of low light that will illuminate the room to a reasonable extent and prevent falling in the dark. 3. Medication. Some dementia medications have side effects that affect a restful sleep. If you notice your patient is having difficulties with sleep, then you have to consult the doctor to know the best time of the day to take the medications. Taking this step will prevent any alteration of sleep patterns. Try to avoid giving a dementia patient sleeping pills, as sedatives and hypnotics only increase confusion in patients. You can also read up more information on the drugs used to treat dementia to have a better understanding. 4. Activeness in the day. You should come up with a plan of daily activities that will keep them busy in the day. Take a stroll, meet friends, and if they are comfortable with it, join a society or club that shares the same vision and goals with your patient. Getting them exposed to natural daylight helps to control the body clock, and leaving the confines of the room is the best option you have to achieve good physical health. 5. Set an easy routine. Some patients find it very difficult to retain routines, so your best bet will be to set a daily schedule that provides familiarity and comfort. Introducing a new routine will only increase unnecessary stress, confusion and anger. Also, you have to find activities associated with a bedtime that encourage good sleeping habits. These activities, which include taking a bath, brushing their teeth, having a milky drink or playing music, help them a great deal. 6. Include naps. You should prioritize napping in the daytime for your patients. Doing this will help them know that there's a provision for occasional rests in the day. While allowing them to get a nap, make sure they don't sleep in a bed. Getting a nap in the day should be in a chair and not in bed. This will make it possible to sleep for a little while and become agile again. You should also make it clear to them that night sleep is the ultimate goal. 7. Stop confusion. Help your patient get over the confusion of daytime and nighttime by keeping a clock next to their bed to show them precisely what time it is. You should also know that it is not just any kind of clock that you need to put, as there are clocks recommended for dementia patients. 8. Promote relaxation. The ultimate goal of sleep is to get some rest and also promote relaxation. Try to create a restful background for your patients and establish a nighttime routine that you will follow strictly. People with dementia are advised not to watch television, as it causes more confusion for them. In the stead of television, play soft music for them. 9. Be a source of comfort to them if they wake at night. In the event that your patient wakes at night, don't be angry, but try to calmly establish the cause of the waking. Try to sit and discuss with them quietly and in low light too. Give them a relaxed feeling and try to repeat those actions that they associate with bedtime so they can get in the mood again to return to bed. Also, keep books away from them to prevent confusion that arises from reading. Monitor them closely to know what occupies their mind and clarify them if need be. The essence of this is for them to get really used to you and willing to talk to you. If you've enjoyed this video, click the subscribe button below and hit the notification bell so you'll know once we post a new video. Also, drop a comment below so we can know your thoughts on fixing sleep issues in dementia patients. Finally, don't forget to check the description below for more details and visit our site www.zimsleep.com for more awesome sleep content like this.